Welcome to Spoil Your Baby podcast. I am so excited to connect myself and you all with Dr. Shereen Lim. Dr. Lim is a dentist with a focus on airway health and early development and is the author of Breathe, Sleep, Thrive, which I've got my own copy of right here and lots to learn there. So welcome. Thank you, Dr. Lim, for being here.
Yeah, thanks very much for having me. I'm excited to be here.
Wonderful, wonderful. So, for parents who've just sort of never heard of it, what are we talking about when we say airway health? I think you kind of touched on it a little bit, but tell us a little bit more.
Yeah, so airway health is really about promoting optimal breathing as early as possible. And what that means is nasal breathing 24/7. So we're designed to breathe through our nose and really having good airway development, especially in the earliest years of life when the jaw structures are growing. So we want optimal jaw development. And because the jaws are influenced by the oral function, we want to promote good oral function as well. So that means really good tongue suction during sucking, swallowing, and breathing, and promoting good chewing habits as well.
Hmm. Can you tell us more about how airway development does shape a child's sleep and mood and behavior and cognition and things like that?
Yeah, definitely. I mean, we are supposed to breathe through our nose. Apart from warming, cleaning, and filtering and humidifying the air before it enters our lungs, when we close our mouth, and when we have our tongue sucked into the roof of our mouth, it's the optimal breathing. It keeps our airway open. So, for instance, if we try to snore with our mouth open or snore with our mouth closed, it's easier to snore with our mouth open. And this is when we're going to get disruptions in our airflow and have snoring, which is leading to more fragmented or unrestorative sleep. Or down the line, if it's unaddressed, it can become obstructive sleep apnea, which is when we have complete pauses in our breathing that can last for seconds, that can be associated with oxygen deprivation. And so when we have snoring or mouth breathing, it does lead to more unrestorative sleep. And we know that there's a lot of research to support that snoring is linked to increased risk of behavioral and learning problems in children. The brain, as we know, is growing the most in the first 3 years of life, and that's when children need the most restorative sleep. And apart from the hours of sleep, we need to check that breathing quality during sleep as well. So yes, we have those type of issues as well. So really promoting airway health or that nasal breathing and good jaw and airway development, it's really the foundation for thriving health and vitality across the ages as well.
Yeah, I ended up having obstructive sleep apnea and having my tonsils and adenoids removed. But we were talking a little bit before that I needed a bit more than that too. If I was born now, I might have gotten even more care, which is important that our kids are getting better care now. What can parents do to promote airway health? We'll talk about what are the signs of if it's not going well. But before that, what are some things that we can do for our little ones to promote it?
Yeah, I mean, so airway health being nasal breathing, we want to make sure that children can grow up with their mouth closed and just pay attention to that. Are they breathing through their nose from the earliest years of life? So how do we promote that? Obviously, nasal hygiene, nasal sprays, non-medicated saline sprays to keep that clear. We also want to make sure that the oral muscles are working really well because that will promote good jaw development. And really, we have to understand that the jaws are our outer borders of the airway. So when you said in childhood, you have the adenoids and tonsils removed, a lot of people think that the airway, to address the airway, we have to go to an ear, nose, and throat specialist to remove tissue outside of the nose that could be blocking it. But there are actually, it's a multifactorial issue. It's not just what's inside the airway, but we have to look at the outer borders of the airway. How big is that airway? So that top jaw is really the palate. It's the floor of the nose. So we know that when we widen the palate, it can increase nasal airflow. or it makes airflow smoother, and it makes more space for the tongue so that the tongue can rest more properly on the roof of the mouth. And that will also help to keep the throat open during sleep. And so the jaws, the position of the jaws, we want those jaws forward. If they're more back, it's a more pinched airway as well. And so your question being, how can we promote good airway health? And that is really to consider that good breathing is not just about what's inside the nose and the throat, but it's about the jaw structures and making sure the jaw structures are going well. And if we want those jaw structures to go well, the things that we can modify, number one is breastfeeding. Breastfeeding is really nature's palate expander. When we have good breastfeeding and optimal latch, that tongue is required to suction to the roof of the mouth, and it extracts the milk through a vacuum. So as the tongue drops down, that's how milk is transferred most efficiently. And it requires a complex coordination of muscles that brings that lower jaw back and forth. So it really develops the jaws forward and wide. So breastfeeding is really important, and understanding optimal latch mechanics, because sometimes you can breastfeed without pain, with good weight gain. But if babies are getting a shallow latch and they're using their lips and they're not really using their tongue correctly, that will not promote the full jaw development. And then we look at things like pacifier use. If we use pacifiers, that'll actually lower the tongue posture. So it keeps the tongue down, so that tongue is not able to provide that expansile force to develop the palate well, but it also increases sucking forces, which actually collapse the jaw structure. So it changes the whole swallow pattern. And the impact is related to the frequency, intensity, and duration of pacifier use. So a lot of parents might think, I just use the pacifier at nighttime only. However, babies are sleeping both
half the day, half hours of the day. Yeah,
it can create considerable impact. We know that pacifier use is related to orthodontic problems at age 4, but that really is a reflection of poor jaw development. So that's looking at the whole function in that way. What else we need to promote good jaw? Chewing as well. So a lot of babies, we introduce purees or sippy pouches, not sippy cups, and the pouch food, where we're not really promoting good jaw activity, and that's more sucking again. So that's constricting the jaw development. So these are the things that we need to pay attention to, making sure that children have clear noses, their muscles are developing properly. And in that first year of life, they're the most modifiable things that we can pay attention to. And if parents cannot breastfeed for any reason, just to recognize, I think our role is really to educate people on the mechanical benefits of breastfeeding. And there are always reasons why some people can't do it or choose not to do it, but letting them know that it's multifactorial. There's other options that we can do, and these are the things that we need to focus on. But I do think, a lot of babies that are relying on pacifier use, we have to ask, why are they relying on it? And I do find that I'm involved in tongue tie management. So a lot of the time when children have tongue tie, they're not feeding optimally. They are sucking a lot of air, sucking and swallowing a lot of air, and they may have reflux-like symptoms. And so sometimes they've got a lot of trapped wind, and that pacifier can really help comfort them. So before medicating children for reflux, adult medications that aren't particularly proven, we need to make sure that they're getting optimal latch and they're not swallowing air as well.
Amazing. Yeah. I think it's so important. I love what you said of like the palate is part of the sinuses, or did you say the lower part of the nose?
Yeah, the floor of the nose.
Floor of the nose, yes. And that's a beautiful thing to think about.
Given that a lot of your audience has infants, I think it's great that there's a lot of sleep consultants that are really now less about, sleep behavior, and also considering feeding issues, because I do think that when we have poor feeding or gulping of air, that is really a common source of sleep disturbance for children or infants. And so if there is any feeding difficulties or if there is gulping or intake of air, definitely see a lactation consultant. And we know that, for instance, the one that I work with the most prominently, she actually gets quite a lot of referrals from sleep consultants. So it's fantastic to see
That's
people
great.
are looking out for that. Sometimes an ear, nose, and throat specialist, if there is like quite clogged up breathing, they may be an appropriate person to seek consult with. So they're probably the main people in infancy. And then as children get older, I personally will see children from 4 years and above. And then we're looking more at the jaw structures and we're really assessing for the tongue function and how the muscles of the mouth are working. And my functional therapist can actually help promote good oral function as well. But I do want to say sometimes, a lot of parents can really worry about it. And sometimes it's really hard. There's that really difficult age from infancy through to 4 years old, which the options are quite limited. It's almost like ENT or, if they don't do anything, people become stuck.
Yeah.
So you can see a speech pathologist who has training in feeding and do activities to get the mouth working better, making sure children are chewing and swallowing better. But realistically, for a lot of kids, I do find that palate expansion or widening the upper jaw is a very central intervention that can shift a lot of things, making more room in the nasal passages and more room for the tongue to allow things to function more effectively. So I think one thing that parents can take home is that if we have a narrow palate, it is an airflow limitation, and you don't have to wait until a child is 12 when all the teeth are crooked and take out teeth. You can actually do early intervention to modify that palate. And there's now a lot more pediatric dentists doing early intervention with palate expansion.
Mm-hmm. And is airway dentist, like looking for an airway dentist, is that something that people should look for or sort of?
Yeah, you want to look for a dentist who is specially trained, who has a special interest in airway health, for sure. Yeah, and one of the key changes that has occurred in 2017, the American Dental Association, they issued a policy statement for the dentist role in airway conditions or sleep-disturbed breathing, and they suggest that all dentists should be involved in screening for these problems in children, and they have a role to modify the airway to optimize breathing. And so that is why more and more people are becoming on board and learning about it. But it still can be very difficult because it's not something that's routinely taught in dental school. A lot of people have had to go and get extra learning to do it. So yes, it is quite difficult sometimes, but it's a growing area. And for the listeners, your listeners now who have infants, hopefully there's a lot more change in the next 4 years.
One more prevention topic that we should at least comment on are oral ties too, right? So that also impacts tongue function and jaw development, palate development. Would that also fall under the category of make sure you see an IBCLC?
Yes.
Very, very young.
And also make sure that you understand that some are not attuned to tongue tie.
Yeah.
Because really, when it comes to tongue tie, it's a very confusing topic. I see people that have had these problems with feeding and air intake, and they have seen multiple professionals.
I've seen that too.
20. And they're told, oh, this problem is something that your child will grow out of. There's no tongue tie, or there's a tongue tie there, but it's not going to impact anything. And what people often don't realize is we don't get any training in tongue ties. Like, we're dentists, we're oral physicians, but we don't get taught about it. Speech pathologists don't get taught about it. Lactation consultants don't get taught about it. So no one really gets proper assessment and training in this area. You have to go to someone who really does have a special interest. And often we develop this special interest because of our own experience with it. So there are more and more people that have it, but recognizing that sometimes you may actually get misguided if you haven't chosen the right lactation consultant. There's quite a lot of difference between them.
That's why it's so confusing for parents out there. So would you say then a dentist who works with ties frequently, would that be a better person to have an assessment with?
Yeah, check with that dental office who are the lactation consultants that they can recommend.
Mm,
Because if I see someone that's called us, I still need to send them to a lactation consultant for
got
a
it.
fitting evaluation.
Got it. Beautiful. Thank you so much for sharing that with us.
Thank you, Julia.
Thank you so much for being here. I'll remind everyone to check out your wonderful book. Here it is again, Breathe, Sleep, Thrive. And for anyone who wants to learn more about you and all the things that you're working on, where can they find you?
Yeah, well, I have recently launched a website for the book called breathesleepthrivebook.com. Really, my goal is to bring this information out to more people, more healthcare professionals, as well as parents, so that we can allow more children to thrive to their full potential. But otherwise, my website, drshireenlim.com.au, as well as Facebook and Instagram, yeah. But the book is also available on Amazon. So that's got the widest distribution.
Wonderful.
Check it out there too.
Amazing. Well, thank
Yeah.
you again. We will put all
Yeah.
those links in the show notes and such valuable information that you're sharing. And thank you so much for your wonderful work.
No, thanks very much for having me. I appreciate it.